Really glad that everybody could join today. Again, a Monday morning. We'll keep doing this maybe every other Monday morning, at least through the summer, and then see what the fall brings to us. So I wanted to go ahead and maybe before we get into the topics of packaging and shipping, since we do have some of my coworkers on, Sadie, do you have anything? I know I didn't ask if for anything in particular, but do you have anything about the cyclospora outbreak or anything else you'd like to share with us today?
Hi, Karen. I was out of the office last week, so I'm not entirely up to date on it, but I do want to remind labs to please submit cyclospora specimens to NPHL. We are sending them to CDC for sequencing in this outbreak, so it is important to get those sent to NPHL.
Yes, and thank you. Please do send, not fresh stool, obviously, but if you receive fresh stool and you tested positive, please put it in the Carrie Blair. If your Carrie Blair was positive, if we could even just have a sample, you could take off about 1 ml. I think that would be sufficient for NPHL purposes. So greatly appreciate that. Usually we can't use it if it's after 4 days. So you might, for the supervisors on today, check your daily log. If you see it, please ask your staff to make sure and dig it out. I know they're busy and that sometimes is very time consuming, but it's extremely helpful to us. So thank you, Sadie. All right. Z, I don't know if, Siddhartha, if you have anything to share as far as PhEP is concerned, or anything else with the state at this point?
Every department.
Good morning, everybody. I'm so glad I could make it this morning. I miss you guys. I don't have any updates that are pertinent to this particular venue. The only updates that we have for both PhEP and HPP are subaward grant budget based.
They don't.
For the long-term care testing program that is being run by Becky Weisel, I know that they are working on creating clearer guidance for shipping, packaging, and scheduling. So as soon as that is put together, I will make sure that I share that with Karen so that she can disseminate to the interested parties. And that's pretty much all I have to update this group on today, but I really appreciate being here.
Great. I appreciate you also being here this morning. Always good to hear your voice. So thank you. And I didn't necessarily ask any of the other DHHS people to be on in regards to what we talked about 2 weeks ago, and that's the when Becky and Daniel spoke in regards to long-term testing. I think as Siddhartha mentioned, it's still being discussed. They're still working out the kinks. And I realize that there hasn't been much for guidance out there, but if you have any problem situations, feel free to call. We can work with you directly as much as possible. So maybe that gets into the main topic today of packaging and shipping, because I know that's been a really, really hot topic. I also apologize because initially when we brought up the subject of category B, these specimens, the COVID specimens being COVID, I know it has created some issues. People don't have category B boxes. They maybe don't know how to what kind of paperwork to fill out. And I had hoped that it was something I wanted you all to be aware of, but we wouldn't really pull the plug until COVID was over. However, that has changed because of last Thursday, I believe. There was a new announcement. Actually, we'll call it the DOT shipping advisory that came about and was put out to all laboratories and anybody shipping. What it said was that recent compliance inspections found that several instances of improperly marked or packaged diagnostic samples that were offered for transport were found. So in response to that, FAMSA, which essentially is the main group that handles DOT, it's what they call their group, the Pipeline and Hazardous Materials Safety Administration. They are issuing the safety advisory to provide information on the hazardous materials regulations that is related to packaging and shipping of the COVID materials. So you can, I have posted the website on our eval. I will make sure that it'll get posted to our website as well. I thought I'd pick out just a few other items that it mentioned. It shares with you a PowerPoint about the packaging and shipping. We've gone over these several times, so I didn't want to belabor the process. But one thing I found interesting is that they really did press the point of making sure that somewhere, it could be under the category B label, that somewhere it's written in case of emergency or responsible person, that you should have the shipper, no, the name, and not necessarily the shipper's name. It could be your supervisor's name if somebody else had actually shipped it. But it could be the supervisor's name or somebody who knows what's in that package. And it has to be somebody that will be reached live. It can't be a pager number. It can't be a like a voicemail. So it is recommended, if you are not necessarily a 24-hour lab, that you might include a personal cell phone just for the duration of the package, which means it's probably there ground-wise within 12 to 16 hours, maybe overnight at the most. So do keep that in mind. I think that they're really going to look for that. It may be that the shipper is also the responsible person. If that's the case, you could list it twice on the outside of the box. So those are just really the basic pieces of information. Do note there are different types of category B labels, but they all must be two different markings. One is the cube that has the UM 3373 listed, and then outside of it, somewhere adjacent, could be on the side, could be at the bottom, but it does need to say biological substances, category B. In reality, the term diagnostic is a very old term, and they no longer accept that on the boxes. Interesting, though, that they use that phrase on their own advisory, because that is an old terminology. So there have been some questions that have come up about, okay, that you don't have boxes for category B. Maybe you're having problems ordering them. We have been putting out some information about box makers who do carry boxes that are useful for this case. Interestingly enough, as I spent a lot of time at the beginning of the last week calling different box makers and talking to them, including Uline. I'm not saying or promoting any of these companies. They Safety Pack, Fisher Price, Cardinal, they all put out their own boxes. When calling them and asking about their category B, the only credentials that DOT says is that it needs to be drop tested, meaning that it has to be configured such it can handle pressure and spillage from maybe a 4-foot drop or 3.9 meters or 1.9 meters, excuse me. So most boxes are not tested. That is, anything that's category B or not category A really are not tested for that. They are box certificate for bursting test, size limit, gross limit, things like that. So I've had people ask me, well, that they have a insulated box, meaning that they have a box with a styrofoam piece on the inside of it, and is that box sufficient? From what I can tell, anything over bursting test size about 35 is sufficient. So if you absolutely can't find a box, or it's getting to the point where I cannot provide boxes anymore, simply because we have now we've not run out, but we are not providing for the test Nebraska anymore. And most of your testing, if it is surveillance alone, will be shipped to Test Nebraska. So Test Nebraska has been in limbo as far as saying that their specimens are how shall I call it? They are inactivated, but DOT does not know that. And DOT, in calling DOT to double check that information as well, they tell me that it doesn't matter whether or not it is. If it's a COVID specimen, that it needs to be shipped as a category B. So really, all they're saying, DOT is saying their regulations don't say that it's not category B if inactivated. They just say all category Bs must be shipped by a category B marking. So that is going back to the advisory that has been put out here to say here that all specimens during this pandemic time, that all shipments of the COVID-19 are classified as a category B under the hazardous materials regulation. So with that, I'm going to open up with any questions that you might have. Please go ahead and take yourself off mute. James does ask the question, if we can't get another cardboard box for transport of category B, what can you do? Being in a hospital, I was hoping it wouldn't be as hard as, say, for instance, long-term care, hoping that some of your other reagents come in a insulated box. If that's the case, I would just double check that mark, make sure that it's a sturdy, heavy box. And if so, I hate to say this because I'm not sure this is really true, but you could probably even print a category B label from online and use that box if necessary. Now, if you don't have a box at all and um, you have something to ship today, yes, I understand. Then it probably needs to be given to the courier at any form that you can get. It's just that we're concerned about that. DOT is definitely on the lookout now. So we want to verify that our couriers have accepted correctly labeled specimens. Yes, another question is, Teresa, thank you for asking if you're using an exclusive courier. No, it's true. You do not need a box that's labeled as category B. In fact, but it has to be a triple package box. It cannot be just handing a secondary container like a biohazard bag to that particular courier like we've been doing in the past, and they put it in their own cooler. Have some sort of a box that they could take out of your refrigerator and put it into their refrigerated cooler or something like that. But make sure they keep it refrigerated. If they cannot, then you're going to have to use an insulated box. So please have this discussion with your couriers. Give them a call, or please give our client services a call to discuss that situation. And of course, you're welcome to call me as well. So unfortunately, our exclusive courier in Nebraska only goes to Kearney. So I realize that you in greater Nebraska might have more difficulty in finding that out. So finding out from your non-exclusive courier what can be done. I hope that helps.
Hey,
And
this is
go ahead.
Karen. This is Teresa Fowler with Regional Lab, and also, oh, my dogs.
That's all
I
right.
just wanted to say that from a Regional Lab perspective, if you're using a shared courier, we are working on putting out some guidance as far as if you have an exclusive courier or not, and how to either order these boxes through our supply portal or work on specific courier relationships to put the onus and the labeling of the samples on the responsibility of the courier. But even though our purple or our maroon satchels, our purple satchels, and our navy blue satchels, even though they're drop tested, we've ran into a little bit of an issue because DOT is saying that the box has to have a cardboard outer shell. And so, as you guys know, we have the styrofoam with the fabric shell. So we are working on some guidance there. And I know some of you have reached out to your account managers and me, and we're really just trying to figure out what the best way is to proceed. And Tony, I don't know if you're on the call today, if you want to add anything to that.
I am on the call and I don't have anything extra to add. We will definitely get the information out when we figure out how we're going to handle it.
And thank you, Teresa. I know that we have kind of bantered back and forth as to what we can do to help our laboratories and our shippers. So if we can, we've talked about maybe getting a nice large category B box for our couriers, such that it has frozen gel packs in it, and then people who have just swabs or something, possibly to put it, have the courier put it in there, but then we are asking our courier to be the shipper. So they're putting it into the last rigid container, and there's some legality there. So in the long run,
Yeah, we've had a lot of ideas.
Yeah.
And we're trying to figure out we might have to put out a few ideas based on where you are and which courier system you're currently using, because Regional Lab employs 3 different courier companies. So we will definitely, and we have some clients that package their own satchels and some where couriers come and pick up from bins. And so we're trying to make it as least disruptive for your workflows, but still make sure we're following the standards.
And we're
So-
also trying to be cognitive of the poor courier who is got a million boxes and they're required to use their own vehicles. So it may be problematic with all the boxes. So we're, again, trying to work out a system that works best for both of us. But regardless, I think just the fact that it's whatever box system, rigid box system is used, it's labeled category B. And then the other real point I wanted to make here, let me find a suggestion. Oh, I didn't get it in there. Oh, I know, I'm gonna have to just change my screen. So give me a second. We also are sharing, and I don't know if you can see this screen right now, but we are sharing the fact that you can use some sort of shipping paper. This is not a shipper's declaration. Shipper's declaration is something you have to use with category A, but this is just a kind of shipping paper that provides everything that's needed to ship a category B. So not only is the category B shipping paper, this shipping paper is not required by DOT, but what's regulated and required by DOT is that the shipper, your laboratory has to have the shipper's name, that person who actually boxed it up, and their facility name, full address, full city, state, zip code, and a contact number. And that's where also you could put the responsible person, or in case of emergency number, that's the number that you would put on. And including what is also required of DOT is that consignee, or which is the recipient. You have to have, again, full name, full address, city, state, zip code, and also a phone number there to contact them. So be sure that you have an NPHL number or a Test Nebraska or Brian number on there, phone number, so that it follows the requirements. So that's why we're recommending something like this, because then it's in large print. It's on the box alongside the category B label. So
Karen, I have a question about the different specimen types. So if they're shipping the blood samples that are for the antibody or the antigen testing, are those samples that have to follow these regulations?
for COVID, you're saying, if it's antibody
Yeah.
or antigen for COVID.
Yep.
So I know that what they say that DOT does not regulate are antibodies and antigens for non-infectious things. So things like cancers, things like pregnancy tests. So anything not infectious would be considered not regulated. So I don't know exactly how to handle the antibody antigen testing for just COVID, because if they have antibodies or antigen, they could have the actual COVID virus there too. So I honestly don't know what to say about that. That is a question I could present to my DOT experts. So Teresa, that's a good point. Yeah.
Thank you.
Any other questions regarding? Okay, well, I'm going to go back then to my agenda.
Karen, this is Teresa. I got to jump off. I got a 10:30, but if anything else comes up, let us know from
Okay.
Regional Lab.
Will
Okay.
do. Thank you very, very much. So,
Karen, this is Tony Gold. I'm jumping off too.
all right. Thank you,
Thanks.
both of you. Much appreciated. So as you can see, it is a shipper's responsibility that we need to make sure that the specimens are properly labeled because ultimately, as you know from DOT shipping training, the shipper's always the one that's responsible and that will be the one who gets the fines. So if DOT really comes on the scene and starts fining people, certainly in recent past, it appears that they've only sent out warnings. But now that they have sent out this national warning, I do worry that there may be some monetary penalties going out. So I do want to make sure that everybody understands the shipper's responsibility. I also shared with you last week that there was a shipping blooper, and I must confess the shipping blooper was from me. So can you see, tell me if you see a box that has my name on it as the shipper.
Yes, we can see it.
Thank you. And I have to confess, it was being shipped to Kathy McPhillips in our good laboratory in Albion. It was being sent frozen, so I had dry ice in it. But tell me, what did I do wrong? So what was my blooper here that I sent out late one evening, like 6 p.m.? And probably by that time not thinking very well. Can anybody even take a guess? Type it. Gerald says no dry ice sticker. Very good. That's very true. I meant to put a dry ice sticker on there because I did have the dry ice weight on there. And I am not using an exclusive courier. So I am required to use a dry ice sticker. However, and it has the correct category B, but somehow I accidentally grabbed infectious substances. So that infectious substance, what you see there is actually a category A label. So obviously this is a discrepancy between category B and category A. They rejected my specimen. So lesson learned, don't do your shipping really late or possibly very early in the morning when you're not quite awake. So thought it was just a good drill or exercise to share with you at this point. Okay. So let's move on. Talking about statewide testing, I don't know if we have any updates either. I know that we have not heard from DHHS about the baseline testing. Is anybody else from DHH on at this point? And I don't know if John's on at this point. He may be.
This is Robin, but I don't have much to update.
That's okay, Robin. So I think there's still the licensure group with Becky and Danielle are still working out the process. I realize it's taken them a long time, but without knowing anything about category B, I suspect it's been kind of a struggle to get that out there, that information out there, or to figure out another method. So anything else, Robin, as far as COVID, what are our numbers like?
Well, it depends on where you're at. Some are plateauing and some days are good days, some days are not so. It really is, we're lower, thankfully, than a lot of the southern states. So if we keep doing a good job with social distancing, wearing masks, and all of those good hygiene practices, hopefully we can stay low. But, you know, after reopening fully last week, we will see what the numbers show this week and next. So it's a daily test to see what's going on out there.
So do you think that facilities are still struggling to find testing? Or do you think that it's getting better and better for ample testing here in Nebraska?
Last week it was pretty rough. This week, I don't know. The southern states are using up a lot of the reagents and materials. So yes, it might be another week, depending on what happens down there, for difficulties in getting those resources. So just keep that in mind. Turnaround times may be longer as well if you use a commercial laboratory. We try to track those things to see if all of that going on is impacting our testing here. So we're looking at that, but it's hard to tell what the system will do from week to week, but there are still a lot of cases, and so I have a feeling this week will also be a rough week for anybody in the northern mid part of the country.
All right, thank you. I thought I would then take this opportunity and open it up, this portion of the meeting, to other laboratorians who are testing. Thank you to Christy Nichols from Bryan to share that they have a ton of capacity. They unfortunately still cannot get enough test kits to run all in-house. Specifically, our drive-through samples have been going out of state for testing. But if somebody is in need of at least some type of testing, there is one option. Does anybody else who currently are testing, can they share what their experiences are?
Hi, Karen. This is Jody.
Hi.
Yeah. Hi there. We have 3 different platforms running. Last week, we ran into consumable issues with both of our high volume, high capacity analyzers. We did get some supplies in, but we are now exploring pooling the low positivity samples coming in for pre-admits, pre-procedural, and the universal screenings. Those positivity rates are about 1%. So we are updating our procedure, doing some workflow and validation. We'll have to get the FDA's approval, but we're hoping that will help us expand our testing.
Thank you, Jody. That's actually very good news. What would you think about surveillance testing too? Say, for instance, from a nursing home. Is that something that would be considered too for pooling?
We don't receive a lot of nursing home samples. It all depends on the positivity rate. So if it was an outbreak type situation, you would not want to pool.
Right.
I think, and the public health has a lot of experience with this. I think once you get over 10%, you're not doing yourself any favors because you're breaking down too many of the pools. We can only do this on our lab developed assay that we have running in the molecular lab. We won't do it for either of our commercial platforms.
Okay. Good to know. From Crete, Nebraska, Shannon Furman has shared that they're unable to get reagents, to get on allocation for reagents. And I've heard that said from other laboratories as well. Very frustrating. I believe Aurora was similar. So I realized that it would be very ideal for all of our laboratories to be able to take on that local testing. That would be extremely helpful to us, I know. But again, as you can see, allocation has been very problematic. Anybody else would like to share?
This is Corliss from Kearney Regional.
Hi, Corliss.
Hi, and we are running the Cepheid platform, and we are on allocation, but we don't necessarily, we're not allowed to order what we want. We get what they send us. And so we are only still testing for direct admits to the hospital or if we have a patient in the hospital. And we have to continue to send all other testing to regional pathology.
Okay.
So I had a call from a lab manager in Fresno, California last week, reaching out to me directly to see if I had any. She said they have 5 different platforms, molecular platforms that they are running, and they were out of all reagents.
Oh.
And she wondered if anything stockpiled here in the middle of the United States that we could send to them, as they were seeing a huge surge.
Wow.
So I thought that was she's just calling labs directly.
Right. That is amazing. They are that desperate that they are calling to, you know, rural sites to just see what's available. Wow. Okay. Thank you for sharing that.
Yeah, we also collected more COVID-19 swabs last week than we have in any week prior.
Okay.
And there is a small surge here, but more and more facilities are requiring for pre-ops within 72 hours of the procedure.
And I can share with you that NPHL continues to be stringent on what we test. I know our guidelines are a little bit older, but they still remain true, and that we recommend that any type of surveillance, pre-surgical, any of that sort would be sent to any of the sites that we have just mentioned if they do take specimens. I know Test Nebraska is still open and still have good turnaround time. So even if you had one patient out of a long-term care, that one patient probably could be sent to NPHL, or maybe somebody that might have been showing symptoms. But anybody else, if you're doing surveillance, it has to be sent to one of the other sites that we've recommended here. So certainly give them a call or give us a call to see what is available. All right. Anybody else would like to state what they're doing in their laboratories? Okay. And I know, thank you, Gerald, he does also say Tecumseh, of course, is also on allocation, and we get 2 kits a week, and that's really it. You know, the big question is who determines those allocations? And that might be a question for any of the DHHS people, Robin, if you're still on, or any of my NPHL colleagues. or if Dr. Iwan, if you're on, I don't know who allocates, the companies necessarily, or if that comes from higher above.
DHHS doesn't have much to do with any sort of allocation.
So it's got to be
The company.
It's the commercial companies themselves, and obviously in short inventory, I'm sure. So Rex from Bridgeport does share that they're allocated 240 tests a week. They do the BD Max. Are you allocated only for your hospital and your hospital patients, Rex, or are you opening to other sites as a reference lab? I guess it would be great to know that information, that if you are opening to other places, it's nice to know. So you are open to other sites. Thank you. And so anybody in Western Nebraska, if you do have a situation that requires testing, please certainly look up your local hospitals and give them business as much as possible. So. All right. Well, I don't have anything else other than to say that we are trying to get out a new lab alert. As soon as we can find out a little bit more about Test Nebraska and a better method of getting specimens transported, we will then put out a new lab alert. So be patient with us. Therefore, I'd like to open it up to any other questions. And while we're waiting, don't forget to sign in your full name and your facility on the chat box. If you came on late, this is our means of sign-in sheet. So much appreciate signing in for us. If no questions, I just want to briefly go over some of the trainings. We are having our last BT training tomorrow at noon. That would be Central Time. And if you have not sat in on the first two, I don't recommend sitting in on this one because they build. We talked about the LRN process and have started practicing it, and so now we're doing some case studies. So if you don't have that background, or if you do have that background, you're welcome to join us, especially if you're just auditing the class. But I would recommend maybe listening to the first two. The first one is on our website under our education tab. The second one will be on our tab hopefully today. Still working to get that up. So with that, we'll record this one tomorrow, and you still have a good month or two, realizing it's extremely busy and everything else is going on with LPX on the mark or out in the system now. So you do have some time that you are welcome to listen to the recordings after the fact. Just make sure that you are registered for that. Okay. And then to share for those of you who are on LPX, unfortunately, one piece of information I've not been able to get out yet is that we are in a flux with media. We have not been able to make our normal motility media. If you are totally out, please contact me. If you do have media, but it was expired, I believe, as of Friday, then we are going to do QC today and of course you can do that too, to confirm that it is still viable. And we will send out a notification that we are extending our expiration date until such time that we can get our media made. So let me know if you are out of media, but you're working on your LPX. I have not yet sent out that challenge set, and I might hold off until we can get media made before we can send those out, because we have a lot more challenge set laboratories. But with the LPX, I do hope that after this month, I know that your last due date is sometime end of July, that we will do a post LPX conference call. We'll still continue to do our breakout groups that talk about how they were able to identify it, because we probably don't have the actual answers out yet, but it'll be past the deadline, so we're not at risk of sharing any data. So with that, I will make sure and get that date out for our post LPX conference, and hope that if you are doing the LPX that you can join us for that. Any last questions? I just wanted to check our chat box to make sure that there weren't any other questions. A good comment has been made that hearing that the White House Task Force is the one who determines allocations, any chance to work through our local government. Again, I don't think that our local government has that capability. It would be nice to advocate for our laboratories. I totally agree. We will continue to ask those questions, however, and see if we possibly can do anything. I think more so though, I think it's important to get the word out for your community to continue to wear masks, to continue to distance, to continue to do what it takes to prevent the spread. So that ultimately will help in the testing situation and keeping our testing numbers down, which is the only way we can build up in our stockpiles of media. So we do what we can, and thank you for joining us today. Our next meeting is scheduled for July 27th at 10 a.m. Central, 9 o'clock Mountain Time. Hope that you can all join us then. And meanwhile, if you have any questions, don't hesitate to call or email. So we appreciate your time today. We'll get you out of here a little bit early. Thank you all. Goodbye now.